Hi, Dr. Ramsey Choucair, a board-certified plastic surgeon here in Dallas, Texas, bringing you another video about a subject that we think is very important when it comes to safety, and that's preventing DVT, or deep venous thrombosis, and/or pulmonary embolus. In the news today, as everybody knows, when you're on a plane or even when you're at your doctor's office, there's brochures on how you prevent or make sure you prevent a DVT, which is a blood clot that can break off in your leg or your pelvis and go to your lung and can cause you to be very sick or even die. So we take this very seriously, as most any surgeon does these days. So what do we not want you to do before surgery to prevent that risk? Well, first of all, we want to make sure when we evaluate you, we know if you're higher risk, whether you have a genetic predisposition or whether you have pre-existing issues that make you at higher risk. And we assess that very carefully. If you are at higher risk or we think there's genetic issues, we'll send you to a hematologist to have lab studies that are specific to see if you have an increased risk of a blood clot. Second, we don't want you to be dehydrated prior to surgery, and we don't want you flying in from a long distance plane flight with your knees bent for several hours or in a car. We want you up and around the day before surgery and well hydrated. We think that makes a difference. During the surgery, we do many things to make sure that you stay safe. It starts with before you even come back to the operating room, we make sure you're well hydrated with a significant amount of IV fluid the morning of surgery when you may not have had anything to eat or drink since midnight. Second, we put TED hose, the compression hose, on your legs, and then we apply the sequential compression device, which is a machine that gently squeezes your leg at intervals to stimulate the natural anticoagulant in your blood vessels. Our nurses in our operating room are constantly moving your legs at intervals during the surgery, and our anesthesiologists, who are all physicians, are careful not to give you any medications that are unnecessary that could make your muscular tone diminished. Those are the things we do, and we monitor you very carefully after surgery. So we have a very strong focus to make sure we prevent that risk of blood clots in the legs that can travel to your lungs, and we're focused on it to keep you safe.